testing facility will be free of cost for the people. Right now, the private labs have been allowed for the testing, and the Supreme Court has said that mechanism can be created to reimburse private labs so that the people do not have to pay. The government has already put a cap of 4,500 rupees per test from the private lab, but of course every family will have to do multiple number of tests. That is the reason why now the Supreme Court has asked them that the government has to develop a kind of a mechanism to inform mechanism so that the private labs can be reimbursed and the people do not have to pay. We have joined by our correspondent Anisha Mathur at this point of time. Anisha, finally the Supreme Court has asked the government to develop a mechanism that the private labs can be reimbursed. The 4,500 rupees cap is also, everyone thought that 4,500 rupees cap can work out for the people, but of course the people will have to go for the multiple number of tests. So of course it was turning out to be a costly affair. What exactly the Supreme Court thought and how the Supreme Court has asked the government to reimburse and develop a mechanism?
Well, right now, in the hearing of this petition was the petitioner had raised the point that a lot of people are not getting a full salary, of people cannot work, and multiple testing is going to put a dent in that. And more importantly, a lot of people are having trouble accessing even the banks. The Supreme Court has also commented that this 4,500 amount is very high, and they have asked the government to consider creating a mechanism by which these private labs could also be reimbursed by the government so that the people don't have to pay for the test. Of course, the Solicitor General has said that the government, there are 118 government labs which are doing 15,000 tests per day, and 47 private lab chains are now being roped in to conduct coronavirus testing. The Solicitor General has also said that the government will consider this suggestion given by the Supreme Court, but clear orders are likely to be passed by the Supreme Court for asking the government to take this step, particularly as more and more testing is required to make sure that the spread of the coronavirus in the country
Anisha,
can be
more
tracked.
and more testing is required at this point of time in India. Right now in Maharashtra, more than 3,000 tests are being conducted, and 47 private labs are in the testing at this point of time. The Solicitor General has promised the Supreme Court that they will consider what the Supreme Court has said, but we are going to wait for the written order at this point of time. Whereas the Mumbai continues to become a coronavirus hub at this point of time, being more than 640 cases at this point of time in a city of Mumbai. The Mumbai's E-ward, consisting of areas like Baikala, Mumbai Central, has emerged as a hotbed of Covid-19 patients after Worli. Till Tuesday, the E-ward had reported 83 positive cases. The Wokhad hospital, where 52 health workers tested positive, also comes under the E-ward. The other cluster of cases were found in Moreland Road, where the 10 from a single family tested positive. At the same time, the D-ward, which is one of the affluent areas of Mumbai, is just behind the E-ward. The D-ward trails both E-ward and G South ward in terms of number of cases, but the D-ward, which covers areas like Pedder Road, Dependency Road or Malabar Hill, reported around 49 cases as of April 6th. That's what the information we are getting. So how the Mumbai is becoming day by day a corona hub, that's what we are trying to make you understand. Now, one of the survivors spoke to India Today, who comes from this very D ward, and he speaks about how that his ordeal, that how he was made to run from hospital to hospital to get tested, and the survivor also recounts how he was troubled by his neighbors, and he was not accepted when he was finally allowed to go back home. Let's listen.
When you were hospitalized, was your family harassed? Do you feel that even educated people in top-notch, posh societies in Pedder Road as well are taking to stigmatizing this COVID-19 positive patients and ostracizing people from society? What really happened? I believe you were a bit disheartened with the manner in which your neighbors have responded to this.
Absolutely. So, I mean, you expect at times of crisis, you expect your nearest and dearest to obviously care for you and actually be there for you. But unfortunately, my neighbors instead decided to ostracize and complain to the police about my father's negligence of the handling of my case in the building, and they actually tried to get him arrested, and I think they in fact failed this entire exercise because the BMC and the government and the police already knew about my entire case, as Kasturba had called me a few days earlier to take my entire case down. So they were very thoroughly satisfied with the mannerism in which I maintained everything. So they had no case, and thankfully my father was not in any danger of getting arrested.
But I believe there was a lot of flack that came in, and even today when you're back at home, do you feel that kind of flack? What do you have to tell such people as a person who's been a survivor and a warrior who continue to stigmatize COVID-19 patients like you?
See, to be really honest, I had done a little bit of a social media reach out to a couple of people, and I think they sort of learned their lesson. And by the time I came back into the building, after I was completely recovered, there has been zero flack since then. But I would just like to get the message out there to people in society that, guys, this is a very simple virus that a person who does not have a pre-existing medical condition or is not suffering with old age or weak immunity, you can actually recover from this. And you can coexist with people in the same house with this virus. So please show your humanity, try and help your neighbors, try and help the infected, try and be kinder and helpful and more helpful to the nurses and doctors in your area. Don't ostracize them, and just show your humanity, you know. In times of crisis, we need to be there for each other. That is all I'd like to say.
But you also mentioned somewhere to the effect that your family was harassed and you did face the stigma, even from the most educated people that you've known.
Absolutely, and it's because I think Chaiti, this is all because of the lack of information that people want to gain themselves. So I don't think anyone is well read enough to understand that this virus actually doesn't pass around as easily as they say it does. But it is obviously a very infectious disease if you do not take the right precautions.
And how were your personal details and confidential documents leaked in this period? What was this letter that was leaked and the circular that was leaked, and what implications that end up having on you and your family?
So the BMC actually, I'm not sure if it was the BMC or Kasturba or what. I don't really know which way in which it was leaked or whatever. But there was a document with every single ward of South Bombay mentioned, and the addresses and the building names of each and every building which was sort of a contamination zone as per the BMC or Kasturba or whatever and whatnot. But the shocking bit was that, yes, it's good to mention to the public to stay away from certain areas because these areas are contamination zones or whatever and whatnot. But the absolutely needless requirement of putting the person's full name with the address right next to it was absolutely not required. I actually felt completely betrayed by my government in this entire regard, that they gave my personal details out, and I was receiving over 100 calls being asked why my name is appearing on this list. And you know, it made it very socially awkward and even professionally awkward for me.
Very sad and unfortunate to hear that. And today, people are listening to you on national TV. What message do you have for our viewers who are listening to you today on national TV as the entire country is now battling COVID-19 crisis?
Absolutely. I mean, I would just like to tell all the public that please just be kind to each other, show your humanity, be safe, stay indoors, take the various precautions on the WHO website to understand how the virus is spread, how to avoid spreading the virus, and simple do's and don'ts, you know. It's a simple 3-minute understanding of this entire virus, and obviously once everyone learns about it, the stigma will reduce, the fear will reduce, and we will actually start caring and being nicer to each other as human beings, you know.
So this is the message, that you should be humane when a corona survivor comes back to live back in the locality. But the main shocker in Mumbai came in after the area around the Chief Minister's residence, Matoshri, has now been locked in. A tea seller, which is hardly 20 to 30 meters away from Matoshri, has been found positive, and the people whom he was serving tea till last 4 days back, around 270 tests have been made, and the area is now completely under lockdown. Let's have a look.
The Thackeray clan's ancestral home Matoshri in the heart of Mumbai's Bandra East is now a coronavirus hotspot. The bungalow and nearby buildings are sealed off and named a containment zone after a tea seller in the area tested positive for coronavirus.
This area has been contained. The entries and exits to this area have been sealed. Movement in this area has been restricted, and the reason that is being given is that a tea stall that is just behind the barricades that have been put up right now, a worker of the tea stall has been tested positive, and that is why the administration, as per the SOPs, has sealed the entire area.
270 people are now under the scanner. Their samples have been collected for testing. Officials have ruled out testing the Thackerays yet. The barricading around Matoshri has been tightened now, and screening heightened in the area.
BMC officials have tested around 270 persons who had come in direct or indirect contact of the tea stall owner who had been operating close to Matoshri, the private residence of Uddhav Thackere, Chief Minister of Maharashtra.
It was, however, business as usual for Uddhav Thackere. The Maharashtra Chief Minister was seen driving out of Matoshri without any security in his vehicle, while security personnel followed the CM's car. Uddhav and Aditya were seen in the car maintaining social distancing. Bureau Report, India Today.
Now, the Maharashtra Chief Minister Uddhav Thackere is going to address the people from Maharashtra at around 1:30 p.m. today afternoon, and he's going to elaborate the plan that how the state of Maharashtra is trying to come over this coronavirus outbreak right now in the state. But with just a week remaining for the scheduled end of nationwide lockdown, the Maharashtra is mulling to extend the lockdown. However, no decision has been taken as of now. Listen in to what the State Minister Rajesh Tope have to say about this.
According to you, do you believe that it is even possible at a moment like this to consider lifting the lockdown a week from now? Is that even a possibility, or it is now becoming more and more difficult to consider lifting the lockdown there in Mumbai?
Actually, just we had a cabinet meeting. Honorable CM took the cabinet, and there is an apprehension that really it would not be very much possible to lift the lockdown, at least in the cases in the area where there is lot of cases coming in. Like in Mumbai and Pune, the cases are coming in, so we cannot say at pan Maharashtra, but yes, in some of the centers where the number of cases are increasing, there is a chances that we have to think very seriously for the extension.
You're saying Mumbai and Pune are your main concerns, and you don't see the lockdown being lifted, at least in these two cities. Am I correct? You see the lockdown being extended. You cannot see it being lifted. Am I correct?
Yeah, I think so, because today there was a lot of discussions, but still there is a expert committee actually advising to the Government of India as well as to the Government of Maharashtra, and in between 13 and 14 we can decide on the prevailing situation at that point of time whether to extend or not. But I see very less possibility for actually not to extend, like we have to extend in some of these areas.
So you're giving us a big news point. Here is Maharashtra's health minister in charge of Mumbai saying lockdown likely to be extended. I want to very quickly ask you your own experience. Mumbai is a hotspot today. Therefore, you're not taking chances with Mumbai, because there are parts of Mumbai where we've had localized spread of the virus, other parts relatively safe. Can you identify and isolate those spots, or is it not possible?
Actually, there needs to be a proper, we have to really have a proper guidance, proper discussion on these issues, like whether we and we have Raj Desai ji, we have to really see to the advisories of Government of India as well, because we on our own will not be deciding on the entire decision of the release of lockdown or extension of lockdown. We are also looking forward.
Right, right. But as I said, as of now, as of today, anyone who's watching this show in Mumbai or Pune, it seems very unlikely that the lockdown will be lifted after April 14th. Am I correct?
Actually, I'm not the final authority, but yes, the cabinet was in that mood itself. Like Honorable Chief Minister also is having an apprehension that whether the lockdown will be lifted or not, because he is also having an apprehension in that regard.
Okay, so it's very clear, increasingly clear, Mumbai unlikely to have a lift in lockdown. Thank you very much, Mr. Tope, Maharashtra's Health Minister, then joining us.
लॉकडाउन के बारे में अभी फैसला लेना बहुत जल्दी होगा। 14 तारीख तक का ये लॉकडाउन है, उसके बाद हम देखेंगे कि अगर पेशेंट्स बढ़ते नहीं है, सारी स्थिति कंट्रोल में आती है तो लॉकडाउन बढ़ाने की जरूरत नहीं है। लेकिन आज की तारीख में मुझे ऐसा लगता है कि कंट्रोल के अंदर है, लेकिन लॉकडाउन बढ़ाएंगे, ये मेरा अपना पर्सनल मत है कि लॉकडाउन अगर बढ़ाया जाएगा तो और इस जो कोरोना को है कंट्रोल किया जा सकता है।
Well, the nationwide lockdown to contain the spread of coronavirus has hit workers of famous Reimbursing circus as well. With no show running, the performers and the animals of the circus are left stranded in Navi Mumbai. Here is the report.
The city of dreams has come to a grinding halt in the wake of nationwide lockdown to combat Covid-19. This is the Reimbursing Circus, one of the biggest and oldest circuses in the country. The circus area, which usually buzzes with sizzling performances, has fallen quiet. Performers and animals are left stranded. The Reimbursing Circus team was at Airoli in Navi Mumbai when they were asked to shut down in the wake of rising cases of Covid-19 in the country. With no shows running and revenue drying up, they are left high and dry.
थोड़ा दिन हम लोग के पास राशन था, वो राशन से हम लोग खाता रहा। फिर राशन खत्म हो गया तो यहाँ का म्युनिसिपैलिटी और लोकल आदमी लोग और एनजीओस, बहुत सारे एनजीओस आके हम लोग को मदद किया। ना किसी के पास पैसा है, कुछ भी नहीं है, हम लोग को परेशानी हम किसको बोलें।
Over 100 workers, 19 dogs and a pony, all members of Reimbursing Circus, are eagerly waiting for the crisis to get over. With Divyesh Singh in Mumbai, Bureau Report, India Today.
Well, that is all with me for news and updates. You keep watching India Today and you stay home and stay safe.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.